5 reasons for why your one testicle may be drawing up. Let's get into it. Hi guys, Dr. Kelli Wilson here, pelvic health expert and physical therapist. I have been treating male pelvic pain for nearly 20 years. Please remember that this is for educational purposes only. This does not replace a medical assessment or treatment. So what gives? Why is one testicle drawing up and just hanging out there, living in that elevated place where it doesn't need to stay? Why is it not going back down and relaxing like the other side is? Let's jump into some possible reasons for why that could be happening. Number 1, the Cremaster reflex may be a little too strong. The Cremaster reflex is when the testicle is drawing up, and that's a normal response to be protective and to allow for temperature regulation, because ultimately sperm is being produced inside the testes, and we need to be able to protect that to allow for procreation ultimately. So our body's physiological response is to protect that. But some men may have hyperactive or stronger cremaster reflex. You can check yours by sweeping your 2 fingers along your inner thigh, and you'll feel that cremaster muscle, which is the muscles inside the scrotal area. So you've got the skin around the scrotum, around the testicle. That's the skin, the scrotal skin. And the cremaster muscle is the layer inside the scrotum. So when the cremaster muscle is responding to that reflex and drawing up, then it's going to be contracting and pulling the testes away to protect it. Having a hyperactive or strong cremaster reflex doesn't equate to a disability, pain, or dysfunction. Sometimes people just have a stronger one. So don't worry if you do have a strong one. However, if it starts going into excessively or progressively more hyperreflexive, then that can result in some issues down the road. Number 2, when the testicular or scrotal region is in a heightened protective state, either due to pain or irritation. This can happen when there's been trauma to the groin region, the spermatic cord, not just the testicular region. And kind of like when you're in a car accident and you have whiplash and those muscles stay in a spasm, that can easily happen within the testicular region. And there's a misfiring and miscommunication to stay in high alert. And the nervous system needs to learn how to respond to that to be able to relax and know that it is in a safe environment. Number 3, cold temperature and stress. The scrotal region is a temperature regulator. As we said in number 1, it helps protect for sperm production, but it also is very, very responsive to stress. Now, we talked a little bit about the cremaster muscle. There is another layer of muscle that is not somatic. So somatic, you would think of a muscle being like the biceps muscle. That's volitional. This is more overran by the sympathetic nervous system, and it's a layer called the dartos muscle. Dartos muscle is innervated, meaning supplied by the sympathetic nervous system, so our fight or flight system. If our fight or flight system, where we feel like we're in a constant state of threat, is elevated and we're just staying in this highly anxious state, that is the connection that the testicles can have. They can start drawing up and staying there because of that heightened anxiety state, because of that connection with the sympathetic nervous system. Number 4 could be a musculoskeletal or nerve-related drivers that are nearby. The scrotal skin and the testes are innervated by nerves coming out of the thoracolumbar region and the sacral region. So we've got upper lumbar area, right around where if we wore, you don't wear a bra, I do, but where a bra strap would go, that those nerves coming out of those levels travel down into the abdominal area, down into the testicular region. And if there is any kind of restriction, hypomobility, or loss of movement in that area, that can be a reason for that nerve to go into a semi-hyperexcitable state and start miscommunicating and misfiring. And if it gets in any kind of entrapment or compression along that nerve's pathway, that can cause a dysfunction resulting in hyperexcitable state resulting in the testicle drawing up, specifically unilaterally or on that one side. And lastly, number 5, this could be a medical problem that ultimately you need to get medical intervention with immediately. If the testicle is all of a sudden drawing up and your pain is highly elevated, this can be very serious, and this could be a testicular torsion, and this would require a surgical intervention. So please go see your provider or emergency room immediately to get this taken care of. To summarize, one side of your testicular region could be due to elevated muscular tone, could be due to an overactive Cremaster reflex response, to elevated stress or temperature, or a lowered temperature due to any kind of musculoskeletal or nervous system influence, all the way up to the upper lumbar level. And it could be an emergent issue. So please take this information, and I hope you found it helpful. If you found this very helpful and would like to start learning more about taking control of your testicular discomfort, please click the link below and check out my free resource. It's the Testicular Self-Help Starter Guide. And please, I recommend you to subscribe below to receive more real education on male pelvic pain.